Short on hospital beds as the Ebola outbreak rages on. Is it time for Canada to open treatment centres in West Africa? We look at whether the Canadian government has the capacity. Also, a frontline aid group that is overwhelmed. I'm Affan Chowdhry. Welcome to Globe Now. Here's a snapshot of the ongoing Ebola outbreak in West Africa. The number of people infected, over 6,000 cases. The number of people dead, nearing 3,000 and counting. And if the problem is not tackled, by November, there could be 20,000 Ebola cases. That's according to the World Health Organization. Canada is playing a role, and in a moment we'll talk about whether the Canadian government and others can do even more. But first, why one aid group is saying it can't do anymore.
Well, our organization and our people on the ground have been faced with an unfathomable situation. They're living through this biblical plague before their eyes, and we're expanding our capacities to treat it. Every week we open a new center, and we're already treating 2/3 of all the patients in West Africa. We're very pleased to do our role, but we are overwhelmed. June, July is when we really came to the understanding that this was already flaming out of control. It had started as a spark, but was now a forest fire, and we were there with water guns. The epicenter of this disease is in an area called Langue de Gekidu, and that area is on the border between Sierra Leone, Liberia, and Guinea. Because it's a very transient area, the cases quickly spread into those three areas before they were even detected. In Sierra Leone, we have the capital, Freetown, which really is defenseless against the upcoming scourge of Ebola. Liberia is the country that has the highest caseload and is the most out of control. We need more than 1,000 treatment beds yesterday just in Monrovia alone. So these countries in West Africa, unfortunately, where the disease has broken out, are countries that have already suffered decades of war. They've just been rebuilding their economies, their health systems, and making development gains. And because this epidemic has befallen them, it's setting all that effort back by decades. It's why they need our support to be able to manage this disease. Why should Canadians care is because Canadians do care. We've always seen their generosity, their support, and their empathy when we've had incidences like the tsunami in Asia or like the earthquake in Haiti. And this situation, the way it's befalling those countries, is the very same thing. It is the emergency of the year, and we have the know-how and the capability to help them.
When it comes to the fight against Ebola, here's the Canadian government's contribution so far. $30 million in aid relief, announced Thursday. Prior to that, Canada had already committed just over $5 million, a mobile Ebola lab, protective equipment, and the offer of an experimental vaccine. But what do West African countries need? They need doctors, nurses, and more treatment beds. Dr. Paul Gully is a public health consultant. He was a senior official at the Public Health Agency of Canada and was seconded to the World Health Organization. We've reached him in Vancouver. Good morning, Dr. Gully.
Good morning.
What kind of capacity do you think the Canadian government has to open up a treatment centre in West Africa?
I believe it does have a capacity. I think we've seen in the past, with use of the disaster assistance response team, that it is possible to put infrastructure like a field hospital and people on the ground in the event of an emergency such as humanitarian disaster. And we've seen from the work of MSF that the kind of facilities you need just to deal with Ebola cases can be done relatively simply.
The disaster assistance response team deals generally, as I understand it, with earthquake situations. This is an infectious disease situation. Does it have the expertise?
In the field, it is possible to set up the kind of protection one needs, and I think that would certainly be within the capacity of DART, of the Canadian government.
So who would staff this field hospital or treatment centre in West Africa?
It would need trained physicians, trained nurses. By training, I mean people who work in a hospital situation, used to infection control. They wouldn't have dealt with an Ebola case or an equivalent before, but that training, I understand, is being offered in the US, for example, and it is relatively short. So I think with the people, if they were interested in doing it, interested in volunteering, then hopefully those people would be available. In addition, we could encourage employers to allow people to go to West Africa for a number of weeks to enable them to assist. Otherwise, people are going to have to volunteer and essentially not be paid.
What do you think is stopping the Canadian government from opening a treatment center in West Africa?
We haven't done it in this kind of situation. We've done it in humanitarian disasters, which are known, they're known quantities usually, known practice, the response. An infectious disease outbreak, which, however acute, has been gradually coming, is not something we've dealt with before, apart from the mobile lab, for example, which has been hugely successful in the past. So I think Canada has to think differently in this response, but I'm sure it's possible.
I mean, how important do you think one or more treatment facilities could be in the fight against Ebola?
I think it adds to what other countries are doing, and I think it's important that Canada is seen to do things. I mean, it's the US, it's China, it's Cuba, it's the UK, and we have, I believe we have that capacity.
A lot of Canadians watching, their federal government will say, that they're doing something, but a lot of people on the front lines are saying that's not enough. I mean, what is the danger here if Canada does not step up?
I think it's a lost opportunity for Canada to show its humanitarian side, to be a global partner in an event which requires a humanitarian response, and therefore Canada's ability to work with other countries in fora, such as WHO, and to influence what is happening not only in infectious diseases or other diseases, I think will probably be lessened.
Okay, Dr. Gully, thank you so much.
Thank you.
Well, we want to hear from you. Maybe you're a public health official, a doctor, or a nurse. Does the Canadian government have the capacity to open a treatment center in West Africa? And is that what it should be doing? Tweet us at Globe Now. That's all for today's show. I'm Affan Chowdhry. Thanks for watching.